everyone, it's Shantae, and welcome back to Kutztown Live. I have with me here today the new RN health coach at Clinical Services. Her name is Linda. How are you doing today, Linda?
I'm doing great, Shantae.
Yes. I'm so happy that you were able to take time out of your day to come here and speak to all of us. But one of my first questions is that I have for you is about the flu. So there have been several reports in regards to the flu. Mm-hmm. And I want to know, why do you think that many students or people in general have been getting the flu?
Well, this is typically the time of year when we see increased flu activity. Colder temperatures keep people inside, and so it tends to spread more quickly when people are enclosed for long periods of time. Right now, the CDC is reporting slightly elevated flu activity in our region. Our region consists of the several states, 5 states, Pennsylvania, West Virginia, the District of Columbia. So they are reporting a little bit more elevated activity in our area in particular, Berks County and Lehigh County. They are seeing elevated activity. They keep track of statistics starting from the beginning of the flu season, which typically is the beginning of October. And actually, Berks County and Lehigh County have had a couple of the highest reporting rates. Berks County's had 113 cases, and Lehigh's had 327. But remember, that's from the beginning of October. So
okay, all right.
Elevated activity, but not particularly severe this year as far as symptoms.
Okay, all right, because those numbers scared me for a bit. I'm thinking it was just recently, but it's from October. This now February.
Yes, so
I guess it's not too bad.
Yep, we're talking almost 6 months here.
All right.
Yeah.
So how can students or, like I said, people in general prevent themselves from getting the flu? I know, one of the things they can do is to always wash their hands and use hand sanitizers. I carry hand sanitizer with me every day.
Good.
Right before I eat, or if there's no soap, I always have hand sanitizer. Always. I always find a way to make sure that my hands are clean. But what other ways can people prevent themselves from getting the flu?
Well, like you said, prevention is the key.
Yes.
And the best way to prevent the flu is by getting the flu vaccine every year. Every year they develop a new vaccine for the strains that they think are going to be most predominant. You can get your flu vaccine as early as September. They're usually available in August. Mm-hmm. And you can get the vaccine through the springtime. We still have vaccine over at Clinical Services. So if anybody is interested in getting one, we highly encourage you to come over. It only takes a few minutes. Mm-hmm. And you don't have to have any money. We'll just charge it to your account. And it just takes a few seconds. So we're encouraging people to continue to get the vaccine. But for those who don't get the vaccine, there are a few things that you can do to help prevent the spread. Primarily, if somebody gets sick with the flu, we recommend, if at all possible, they go home. If they can get back home easily and isolate themselves until they're fever-free without the use of medication for 24 hours, we highly recommend that. A fever, we consider anything over 100 degrees. So if a student is sick with the flu, we ask them to go home and stay at home and not return to campus until they're fever-free for 24 hours without medicine. If they can't go home, and that's not always practical, then they can isolate in their room and follow the same precautions. And if they have a meal plan, we have flu buddy passes, so if they have a meal plan, they can have somebody go get meals for them and bring them back to their room.
Okay, I didn't know that.
Yes, we do. We have flu buddy passes. They can pick them up at the desks in the residence hall. We have them at Clinical Services. So if they have a meal plan, they can still get their meals. But if we're asking them to isolate, of course, we don't want them going over to the Cub Cafe or down to the dining hall. So we have these passes so friends can pick those up for them. And just isolate until their fever goes away. Take fever-reducing medicines, lots of rest, lots of fluids. If they do start with symptoms, we encourage them to get in as soon as possible, because if you get in within 48 hours, we can give you Tamiflu, and that will reduce the severity and the duration of the flu. So, and of course, like you said, good hand washing, not sharing mugs or glasses or anything like that, covering your cough, covering your sneeze. That's always those are always good measures, regardless of whether it's flu season or not.
Mm-hmm. And you did mention about the flu vaccines. Are those free for students here, or do you have to pay?
We do charge. There's a
Mm-hmm.
$15 charge for the flu vaccine. You don't have to have any money to have it done. You can come into clinical services, we'll give it to you, and it'll just get charged to your KU account. But we do charge for the vaccine. And
Okay.
like I said, we have several doses left, so we're encouraging students to come over because we are seeing it on campus, so it's not too late to get it.
Okay. And when do the flu vaccines? When do students typically get them? Like you said, like people can get flu vaccines as early as August.
Mm-hmm.
So what is the month period?
Well, we typically get our flu vaccine sometime in August, early September.
Mm-hmm.
And basically, the CDC says as soon as it's available, you can get it. Now, students typically, we offer flu clinics at the beginning of the school year. We will be putting some dates out for the fall, but we have several dates scheduled for next fall that typically that's when we see the students getting it. But again, you can get it through the entire flu season, so it's not too late to get it now, and you can get it up through March. So the most
okay,
active
still got another
time.
month.
Yep. So there's still time left to get it.
All right. That's good to know, KU students. But speaking of other viruses, what do you think about the Zika virus?
Oh, wow. It's getting a lot of media attention right
Yes.
now. I'm by no means an expert on the topic. I can just share with you some of the information that we've been reading off of the CDC website, which is an excellent resource. Highly anybody who has any questions, it's always a good place to go. But right now, the CDC is reporting that most of the cases that have been reported in the U.S. so far, all of the cases that have been reported in the U.S. so far, are travel related, meaning that the people that are getting the disease have traveled somewhere where there's high activity and are returning home with it. Many of the cases of Zika, the patients are asymptomatic. 80% of the cases, they don't have any symptoms. And in the few cases that they do, they're very mild. But the biggest concern with it is the potential implications for pregnant women.
Yes, I did hear about that.
Right, a lot of the media attention has been towards the microcephaly that they're seeing many of the babies being born with in the areas of high activity, which primarily right now, Brazil, South and Central America, Brazil is seeing a lot of activity, and so that's where we're seeing a lot of the side effects with the microcephaly. There's travel warnings out or travel advisories out for many areas. And I think if there's one message I want to get across, it's for any students that are thinking of traveling over spring break. I highly advise them to check the CDC website.
I'm traveling.
Yeah, there are several areas with higher virus activity. It started out in Brazil and South America. We're seeing it in Central America, but it's in the Caribbean, U.S. Virgin Islands, St. Martin, areas of Mexico. So for a student who's thinking of traveling, they need to check the CDC website, see what the advisories say. And the big thing that they're pushing, again, is prevention and using the insect repellents, DEET, D-E-E-T, something that's at least 20% DEET. So applying that regularly, if you can, covering any exposed areas, wearing long pants, long sleeve shirts. In the evening when you're sleeping in air-conditioned areas so your windows are closed and you're not lessen the potential for the mosquito bite to begin with. But check the CDC website. We also have a link on the KU Health and Wellness website to the CDC, so they can just go to our website and link to the CDC with the most up-to-date information as well.
So what exactly is the Health and Wellness Center website so that students can know?
KU Health and Wellness. It's
Okay.
If you go onto the the university website and you click on the Health and Wellness, you'll get to our website.
Okay. All right.
And
That's
there's
good
links
to know.
there.
Speaking of the Health and Wellness Center, what other services are provided for students?
Oh, we provide a lot of services for our students. Over at Clinical Services, we have 7 full-time nurses that are there for scheduled appointments for students every day. We're there from 8 to 6. We also have a team of 5 physicians. We have a nurse practitioner and a PA that are there at various times throughout the week. We have a physician in Clinical Services for a half a day every day to see students who might require further evaluation after they've been seen by one of the nurses. We provide women's health services. We have 2 women's health providers who can do regular GYN exams for our female students. If we have students that are interested in going on birth control, we provide counseling for that. And we do STI testing as well. We actually are receiving money through a grant right now that's covering the cost of the STI testing and the women's health services. So what that means for students is if they come in for STI testing, it's free, it's confidential, and if treatment is indicated, the treatment is free as well. For the female students who may be coming in for our gynecological services, those exams are free. If they choose to start on birth control, those options are free as well. Again, because we have this grant. So as long as the grant continues, we can continue to offer those services for free. We have a nurse that does allergy injections. So if you're a student who sees an allergist regularly and has to get injections for seasonal allergies, we do that. We do TB testing. A lot of the students that are going into education and need to get their TB testing done before they can go into the schools, we do that. And we also have a self-care area over at the health center, and it's just what it sounds like. It's just outside of the clinical services area, and it's self-service. We have some over-the-counter medications out there, ibuprofen, Advil, Tylenol, decongestants. There's some first aid supplies for students who maybe they don't feel like they need to be seen by a nurse or a doctor, but they need something. They have a runny nose or they feel like they're getting a cold and they just need some Tylenol and a decongestant. They can just come over and help themselves at the self-care area. So if they have any questions, they can just stop in and we can guide them as far as what they should be taking.
Yeah,
So.
yeah. I visit the health center every couple months or so, and I could definitely say that it's been very helpful for me. And I'm glad the services are free because I know friends that attend other Pennsylvania schools. They said that some of the services aren't necessarily free, such as like the birth control or the testing. They said they actually have to pay between $40 to $50 out of pocket.
Yeah.
So I do think that it's great that the services, most of the services, if not all, are free. And I hope, that, you all will continue to have the grant. I'm graduating, in May. So unfortunately, I will have to pay, once I, graduate. I'll actually have to attend, another doctor or a provider. But yes, I do hope that the school will continue to receive grants so that those services can continue to be free.
One of the other things I forgot to mention is we also do, the first Thursday of every month, we do a GYT day, Get Yourself Tested Day. And that's a day where we do STI testing, no appointment necessary. You just walk in and have it done. And we have several nurses that have devoted a lot of time and energy into developing the GYT day, and it's been quite successful, and we're going to continue with that. So we've been very fortunate with the grant. The students, the KU students do pay a health center fee that covers the doctor's visits, but the women's health services and the STI, as you said, that's been covered through the grant, and we've been very fortunate with that, and we hope to continue to provide those services for our students.
Yes. I do have another question for you. So, as I mentioned earlier in the show, that you are the new RN health coach at Clinical Services. Can you tell me a little bit about your role?
Well, sure. It is a new role, so it's still in the developing stages. But the RN health coach role was set up to help students in a variety of ways. It's a faceted role. One of the things that we're hoping to help students with are students who are in need of health insurance. If they require assistance in just accessing the healthcare marketplace and getting started on the process of getting health insurance, that's something the RN health coach could help them with, and navigating through the website a little bit and helping them see what their options are. The student ultimately has to make the choices, but we could certainly help you get started down that path. One of the other things the RN health coach is going to be doing is sort of working as a coordinator, a liaison, an advocate, call it what you want, to help students. If, say, students need referrals for outside services, perhaps they need to go for a CAT scan, or one of our doctors sees the student and thinks that they need to go see a specialist for a certain problem. And if the student's not quite sure where to go or how to schedule that appointment or what their insurance would cover for that, the RN health coach could help them with that process.
Mm-hmm.
One of the other things that the RN health coach is going to be doing, and this is kind of an exciting part of it, we put out a monthly newsletter. There's a monthly newsletter that's available to all Kutztown University students called Student Health 101. And it's a monthly newsletter that just has a variety of health and wellness topics in it. And every month, Kutztown has 6 customized pages in that e-newsletter. And one of the roles of the health coach is going to be to coordinate the submission of those pages. And so we've been seeking out students who might be interested in submitting information, submitting articles. Right now they're having a contest for videos, and students can submit a video, and if their video gets chosen, they will win a prize. So we're really trying to promote that, and that's going to be one of my primary responsibilities there. So I'm excited about that. In the upcoming March issue of Student Health 101, Kutztown itself is having a little contest. So I encourage students to take a look at the March edition and see if they can find the contest, and the prize. 10 people will win a $10 Bear Bucks gift card if they can find the hidden coupon in the next edition.
Okay.
So be sure to look for that in the March edition of Student Health 101, which will be out beginning of March.
All right. Sounds good. So how do you feel about the position?
I'm excited about it. It's new. So I've been tasked with developing it, and it's been very exciting because I've had the opportunity to come over and meet you and do pieces like this on KUR. I've gotten to know a lot of the different organizations on campus.
Mm-hmm.
It's enabled me to get to work with the students in a different way, as opposed to seeing them only when they're ill and not feeling well. And I still will be doing that half of my time, but the other half of the time it'll be working on the health coach role. So I think it's great for Kutztown University, and I think it's going to be a lot of fun, and I think it's going to be very successful.
Wow. Yeah, sounds good. And what role did you have before you got this one?
Well, I've been here at Kutztown for a little over 4 years. I've been a registered nurse for almost 30 years. Prior to working here at Kutztown in college health, I worked in school health in the public school districts of eastern Pennsylvania. Mm-hmm. And my original experience when I first came out of nursing school, and for about 10 years after that, was in cardiology and working with cardiac patients. But majority of my experience the last 15 years has been working with student health from pre-K and preschool up through high school and now college. So I've hit a lot of age groups. And It's fun. I really enjoy working with the college age students, the interactions. They're wanting to learn about how to take care of themselves. For a lot of students, when they come over to the health center, this is the first time students are sick after being away from home and learning how to deal with it on their own. And they're usually very receptive to the things we have to teach them. And we have great students here, so it's fun working with them.
Yeah, wow. Sounds like you've been all over, and, now you're, working here at Kutztown University, which is good. What are some of the goals you hope to accomplish, with this new position?
Well, our goal here is to focus on wellness and prevention. Prevention of illness. That's why we focus on having clinics to screen for STIs, and we have flu vaccine clinics because we want to move toward keeping the student well and preventing illness. And that's where education comes into play. And that's one of the things, talking with groups of students, offering educational information on how they can prevent things, certain illnesses, and developing healthy habits, changing bad behaviors to develop more healthy habits and minimize illness, keep them healthy, keep them in class, and that makes for a successful student. So our goal was really promoting wellness and prevention. Prevention is our key here.
Okay, it sounds great. And I want to thank you so much for, like I said, taking time out of your day to come here and discuss your new position and discuss some of the goals you would like to accomplish at the Health and Wellness Center. And I'll definitely be there, sometime next month. I always go there to get my daily checkup. But yeah, thank you so much for coming here on KUR, and I hope you have a great day.
Well, thank you. Thank you for having me. It's been a pleasure.
Have you ever needed help finding reliable sources for a paper? The librarians at the Rohrbach Library want you to know that we can help. Librarians can help you with any